All right, good evening, everybody, and thank you for coming to our July monthly provider seminar. The topic this evening is involving partners in PMAD awareness and treatment. Want to get started because there's a lot to cover today, and I want to be mindful of everyone's time, so thank you for showing up on time tonight. My name is Paige Bellenbaum. I'm the founding director here at the Motherhood Center. I'm also a social worker, and I take particular interest in work involving partners. One of the things that we offer at the Motherhood Center, and I'll get to this in just a moment, is that I run a partner support group for women who are in our partial hospitalization program. And I've learned a lot from partners in particular over the past couple of years, and what it's like for them as they try to navigate the waters of supporting their wife, girlfriend, or spouse who's experiencing a perinatal mood and anxiety disorder. And so having had that experience for some time now, take particular interest and recognize the undeniable value that partners play in both understanding, recognizing, and helping support the new or expecting mother in their life who might be experiencing a perinatal mood and anxiety disorder. I just wanted to let everybody know this will be recorded. It will be available after the fact. Everybody will receive the PowerPoint that I'm going to go through tonight, and it does have a lot of active links on it, so you'll be able to access all of the resources that I mentioned throughout the PowerPoint. So without further ado, the Motherhood Center, if you're new to our work, we exist to provide education, support, and primarily treatment to both new and expecting mothers that are experiencing what we call perinatal mood and anxiety disorders, which most people know of as postpartum depression or the postpartum. I'm just going to spend a few seconds today just glazing over PMADs just as an introductory in the event that they are new as a concept to any of you, but I won't spend too much time on them. So just a little bit about continuing on about the Motherhood Center. We offer different levels of support to both pregnant and new mothers that are experiencing postpartum depression, anxiety, and a number of other diagnoses that I'm going to get to in a slide or two after this one. And we do it in various ways. We try to cover the full spectrum of symptom acuity. And so on the more mild side of symptom acuity, we offer a lot of support groups to new and expecting moms that are struggling with the transition to motherhood. We also do a lot of education, like our monthly provider seminar series that you're joining this evening. We also from time to time do webinars that specifically target the new and expecting mom population. We offer outpatient treatment, so individual therapy and medication management with reproductive psychiatrists who specialize in medication that's safe and effective to take during pregnancy and postpartum. And then what we do that really doesn't exist anywhere else is our day program. It's an OMH Article 31 licensed partial hospitalization program. And it's a much more intensive level of care that we offer to pregnant and postpartum women. It's more than just seeing a therapist once a week or a psychiatrist once a week. It really involves women 5 days a week for about 5 hours a day, where they're getting very robust care and support to get better faster. So what are PMADs? 1 in 5 women experience them. They manifest typically in either mood or anxiety disorders. And when severe enough, even on the moderate scale, they can really impact a new or expecting mom's ability to connect with the baby, care for the baby. And women can feel it both emotionally and physically, depending on the severity of their symptoms. What falls under the PMAD umbrella, perinatal mood and anxiety disorders, includes perinatal depression, so some symptoms affiliated, low mood, sadness, diminished pleasure, hopelessness, perinatal anxiety, which includes constant worry, intrusive thoughts. Perhaps a new or expecting mom can't turn her brain off. It's like a hamster wheel. Perinatal OCD includes obsessive thoughts, rituals, and compulsions to neutralize the anxiety. Perinatal PTSD, avoidance, nightmares, flashbacks, hyperarousal. A lot of women experience perinatal PTSD in regards to birth and having a traumatic birth. And postpartum psychosis, which is an emergency. And this includes delusions, hallucinations, paranoia, disorganization, a real loss of sense of reality, and always a 911 call. So why are PMADs important? To help us paint the page of why it's so important to involve partners. So again, generally 1 in 5 women experience a PMAD. Those of us who do this work know it's more like 1 in 3. It's just that there's such an enormous amount of shame and stigma that surrounds perinatal mood and anxiety disorders that 80% of all cases go undiagnosed and untreated because women don't tell, because they're scared they're gonna have their baby taken away. They're scared they're gonna be judged. They don't want anybody to know that they're not loving every moment of motherhood. In the pandemic, rates have risen exponentially. There's some research that came out of Canada that suggests 72% of all pregnant women are experiencing depression and anxiety. 40% of low-income women experience a PMAD, and that's not during a pandemic. I'd say that those rates are closer to 50%. They're the #1 complication associated with childbirth. If untreated, PMADs can lead to poor mother-baby attachments and developmental delays in children. And they're the leading cause of maternal mortality in New York City and in the US. And that's startling and alarming. What puts women at risk for PMADs? A history of mental illness, either she herself or a family member. If she's experienced a previous PMAD, she runs a higher risk of developing a PMAD in subsequent pregnancies and postpartums. Stressful life experiences and circumstances, finances, relationships, abuse, substance use, these can all be contributing factors. Unplanned or unwanted pregnancy, traumatic birth or NICU experience, and then the pandemic, which just left so many perinatal women feeling isolated, not having any social supports, managing high levels of stress and anxiety. And this really contributed to these high rates that we're seeing now. And when they're not treated, PMADs, they can have an impact on the family. They can lead to impaired mother-infant interaction. Children of untreated depressed mothers often go on to experience behavioral, cognitive, and emotional problems. Both mother and child can exhibit impaired relationships with other children, their partner, and other family members. But yet when we treat PMADs, it has a positive impact on the family. It's a remission in maternal depression. It improves relationships and connections and bonding with baby, partner, other family members. And really the most important thing to remember is a well mom equals a well child, but in this case, ultimately a well family unit. So we're going to talk a lot tonight about why partners are important to PMAD awareness and treatment. In the work that we have done over the years as treatment providers for the perinatal population, one of the things that we hear over and over again is how women relate their experiences to water. And most often the experience of drowning, right? When I had my postpartum depression, I felt like I was drowning and I was just paddling as quick as I could to keep my head above water. Here's a quote that actually came from one of our former PhD graduates. My postpartum depression was so debilitating, I couldn't do anything for anyone, especially myself. All I could do was paddle as hard as I could to keep my head above the deep sea that I was drowning in. I just needed someone to throw me a life preserver and pull me onto the shore. And this really is the pillar of why involving partners in particular is so important for women that are experiencing a PMAD. For so many women that are experiencing moderate to acute symptoms, they themselves will describe feeling a sense of paralysis, feeling frozen, incapable of completing very simple daily tasks, perhaps not wanting to tell anybody that they're struggling, being fearful. And this is where partners can play such a crucial and critical role to help these women get the treatment that they need to feel better. They can't do it themselves. It feels like too much. And this is where partners can throw that life preserver in to ultimately make all the difference in helping and improving the whole family system. So the intention of this evening, and hopefully the audience that's participating, are providers in some way, shape, or form working with new and expecting mothers. So I realize that every discipline that might be here and every position that you have in your workplace has limitations. So I'm going to be like throwing out every possible thing that we could do to involve partners more effectively in education and connecting their wife or girlfriend to treatment and education, but you will pick and choose what works for you. So just know that there are many of these things I'm aware of you will not be able to do in your workplace, but hopefully you'll find some stuff in here that you'll be able to apply. So as we know, partners are usually present for at least one visit, if not more, when it comes to prenatal checkups with an OBGYN, with a midwife, while meeting with a doula, while meeting with a pediatrician. And so this is a wonderful time to engage a partner initially in PMAD education and awareness, right? So what we know to be true about women who are at greater risk of developing a PMAD is their mental health history. So being able to, if possible, have a conversation with a mom while partner is present about her own mental health history. Does she have a history of depression and or anxiety? Does anybody else in her family? This really opens up the conversation to focus on her own mental health and how that might translate in the perinatal period. So we can then explain that women with a history of mental illness are at a greater risk of developing a PMAD. And then we can start to launch into speaking to the couple about what PMADs are. We can offer some of the statistics, how prevalent they are, how treatable they are, and how many women, unfortunately, do not receive a diagnosis or treatment because there's such a stigma around maternal mental health, which is unfortunate. Because what ends up happening is that women don't get the treatment that they need and deserve, right? So critical for partners to hear this too. We can talk a little bit, if possible, about different screening instruments that a new or expecting mom might be introduced to throughout her perinatal, her pregnancy and postpartum. We can explain to them that there are a couple of common and frequent instruments, most in particular the EPDS, which is 10 questions that really look to determine whether or not a new or expecting mom might be experiencing depression or anxiety. There's also the PHQ 9 and 2 to just say you might come across this and that it's really important to answer the questions honestly, because in doing so, it allows our healthcare providers to get a better sense of what's really going on and to connect them to the care and support that they need to feel better. We can also explain to the couple how PMADs can strike at any time in the perinatal period. A lot of people have this misconception that postpartum depression happens immediately after having a baby. Whereas what we know to be true is that 50% of PMAD cases originate during pregnancy, right? So, and that that the onset can be different in the postpartum period. Some women experience severe depression almost immediately after having a baby. Some experience it 3 months later, 6 months later, 9 months later. That there is at no point in the 1 year postpartum experience that a woman is totally in the clear. Now, granted, rates start to drop more the closer we get to 1 year, but there still can be PMADs that emerge later on within the first year postpartum. So to just let them know, keep your eye out. Right? We want to be looking and observing from the first day of inception all the way until 1 year postpartum to see if moms are struggling and need extra support. Also, while we have a partner present and a couple either once or subsequently, we want to talk about the symptoms of PMADs. We want to talk about using layman's terms and kind of staying away from clinical speak, because we want couples to understand what things look like in their own language. And we want to be mindful of ways to communicate. So some ways that I like to kind of use layman's terms to describe PMADs: a sense of hopelessness, helplessness, not looking forward to things, having a really difficult time completing daily tasks, making decisions, not finding joy in the things that we once found joy in, feeling incredibly overwhelmed, irritable, feeling as though we made a mistake, that we feel like maybe we shouldn't have had a baby, that we're not connecting with or bonding with the baby, that we completely are grieving the loss of and missing who we were before we became a mother. Now, I want to say that these symptoms do not necessarily individually or even as a cluster mean that a mom has a PMAD. But as we start to see a number of these symptoms, it might suggest that something else is going on. In the anxiety realm, feeling like our mind is a hamster wheel, jumping to conclusions, all or nothing thinking, focusing on the worst possible case scenario, feeling a sense of impending doom, that harm is going to come to the baby, having scary, intrusive thoughts of harm coming to the baby, sometimes mom feeling as though she's the one that might hurt the baby. Being able to list off some of these symptoms to just raise the awareness for the couple in the event that one of them experiences these symptoms or that a partner observes these symptoms. We can talk about the difference between baby blues and PMADs, that 80% of all new mothers experience baby blues, and they usually last anywhere from a few days after giving birth to up to 2 weeks after giving birth. But if they go on beyond those 2 weeks, right, and baby blues can include irritability, a sense of sadness, weepiness, overwhelm, feeling, perhaps like, this was the wrong decision, but that these things do dissipate over 2 weeks. But if they don't, or they become more acute, then there might be something else going on. To talk about with them what to do if a PMAD symptoms arise. Like maybe in your practice, you can have a resource list of perinatal mental health specialists that you can give to partners, to partners and couples early on. So they have that list, they can post it on their refrigerator. They know what to do if new or expecting mom is struggling. And then also explain what a PMAD emergency looks like. Psychosis really is a PMAD emergency, right? When a woman is experiencing hallucinations, delusions, if she seems to have she seems very out of touch with reality, or if mom is suicidal, if she has suicidal ideation, right? If she has thoughts of harming herself or potentially the baby, these are times when we might have an emergency on our hands and we want to call 911. We want to get mom the help that she needs and deserves immediately. And normalize maternal mental health. As providers in the field of maternal health, so much focus is on just that, maternal health. And I like to offer that, if we look at the woman as a whole, right, in the perinatal period, and really this is just the whole of any human, but we're here to talk about pregnant and postpartum women with PMADs, that there are two halves to her whole. There is her physical health and her mental health. And when we think about perinatal health, both of these things need to be part of the equation. And 50-50, perinatal health and mental health need to be a part of the same conversation all the time. And when we're talking about the risks of pregnancy, we talk about preeclampsia, gestational diabetes, all of these things that can happen to women from a physical perspective. We always need to be talking about maternal mental health as well, so that we can start to destigmatize all that surrounds mental health and maternal mental health in this case, and we can normalize it so that if it happens to that new or expecting mom or couple, that they know what's going on and they don't feel so alarmed or concerned, and they feel prepared to know what to do. So some basic psychoeducation that we can provide to partners and couples on those first few visits, just to kind of give them a sense of what PMADs are, if they want to read some articles to broaden their understanding. I have a couple links here. Again, these will be in the presentation when we send it to you, so you can take a look yourself. There's a great article that one of our former reproductive psychiatrists actually helped write that's in Very Well Family. There's quite a few actually around postpartum depression. The one that I particularly love is When Your Partner Has Postpartum Depression. So it highlights a lot of what we're going to be talking about here tonight. It's an easy read for couples. It's an easy read for partners to just kind of familiarize themselves with what we're discussing. There's also a great interactive article in the same publication, How to Talk About Postpartum Depression with a Loved One. So how to have the conversation if you as a partner are concerned about the new or expecting mom in your life and think she might be suffering from a PMAD. And then a lot of what we've done over the years at the Motherhood Center is talk about PMADs, what they look like, what are symptoms, what to do. So if you visit our press page, we also have a lot of literature that can be used as psychoeducation to help inform couples. Some books that I love for partners in particular. Now this is outdated, and this book that I'm about to suggest was written in 2001. If it was written today, it would have a different title, but it's called The Postpartum Husband by Karen Kleiman. It's a very simple bulleted book that explains in detail what it's like for a new or expecting mom to experience a PMAD that's tailor-made for husbands/partners. So that's a great read. And then there's another wonderful book called Beyond the Blues. And chapter 4 is dedicated specifically to partners who have a wife, spouse, or girlfriend who's experiencing a PMAD and ways that they can respond, be helpful, supportive. And then if you have the capacity, and just to let you know, we are actually working on this ourselves to be able to bring to the general public, but creating an in-house brochure, one-pager for couples that just talks a little bit about what PMADs are, what the symptoms look like, what to do in the event that you have one, to hand out to couples can also be a really great resource. Encourage them to bring it home, stick it in a visible place in the event that they might need it somewhere down the line. What I really love to encourage couples to do is, we as providers and women are encouraged to create their birth plan, which is important, right? And what we will always say is, sometimes it comes out the way we want it to, and sometimes it doesn't. It's kind of a roadmap for what might happen, but to be really open-minded, because birth has a way of delivering exactly the way it wants to. And so, but nonetheless, women and couples sometimes work very hard at determining what their birth plan is going to look like. Couples also need to consider creating a perinatal mental health plan, right? In a similar vein, mapping out what to look for, what to do, what are some of the symptoms that might be striking, that might suggest that she's experiencing a PMAD. Sometimes it can be hard when a woman is experiencing a PMAD to say to her, I think you're really struggling with words. It can lead to a new or expecting mom perhaps feeling defensive or irritable or ashamed or guilty. So maybe even coming up with a code word or symbol before a PMAD strikes that represents to each other, I'm worried about you. I'm worried about your mental health. I think we might need to get you some help. And this goes for both couples. We're going to spend a few minutes at the end talking about how dads and partners also are at risk for developing PMADs. Couples can decide ahead of time what to do if either of them is struggling with a PMAD. Who would we tell? Who would we ask for help? How would we do that, right? So that's all part of our perinatal mental health plan if it should happen. And identifying perinatal mental health providers in advance, a therapist, a reproductive psychiatrist if possible, PMAD support groups that are available to a new or expecting mom who might be struggling. These are all great things to do in advance, because when you're in it and you feel like you're in a state of crisis and you need help immediately, oftentimes I hear so many women and couples say, I wish I knew more about this. I wish I had this at my disposal beforehand so that we didn't wait so long, or so that we didn't feel so, you know, disorganized or unaware of what to do or who to call for help. So what partners can do if a PMAD happens, right? If I'm a husband or a boyfriend or a partner and I'm seeing my girlfriend or wife struggle and I think that a PMAD might be happening, we can be the ones to reach out to help for her, right? A lot of times, as I mentioned in the beginning, mom is not in a position to do so. This is why it's so important for partners to be armed. They can reach out, they can make the calls, they can talk to providers, they can describe what their wife or girlfriend is going through, they can set up an appointment, they can get their wife or girlfriend to the appointment, they can do whatever it takes to get her to treatment, right? They can do that. They can reassure her and tell her this isn't your fault, that you're not alone, that I'm here to help you and that you're going to get better. They can encourage her to talk about how she's feeling and listen without judgment. This can be really hard for anyone, in particular partners. They can help out with caring for the baby and housework and anything that has to be done around the house before mom asks. A lot of times dad's partners, kind of look to moms to be the one to like know how to do all this baby stuff, when really moms in general, but particularly moms with PMADs, don't know. They don't feel like they know the right way to do anything. They don't feel that they're doing it the right way. So partners stepping up and jumping in and not waiting to be asked can be a key component to supporting her. Encouraging her to take time for herself, taking breaks, sleeping. Partners really need to step in if a girlfriend or wife is experiencing a PMAD, especially around sleep, taking night feeds, maybe even bringing the baby into another room. Mom needs her sleep. If she doesn't get it, it's going to exacerbate her symptoms. Don't expect her to complete things that she normally might have been able to do around the house because she's home, because she's going to have little to no motivation and it might just feel too overwhelming. Always be honest with her and realistic about when you're going to be home. Come home on time, keep your word, don't leave her hanging. New moms feel already as though they have so little control over anything. So being able to rely and trust is everything. Partners can offer simple affection and physical comfort, but also allow a lot of patience if new or expecting mom is not feeling intimate. Depression, anxiety, pregnancy, and birth can all have an impact on how a woman experiences intimacy. And ask her how you can help right now, right? A lot of times new expecting moms might say, I need help, please help me. But it's hard for a partner to know exactly what that help looks like or what she needs. So what can I do for you right now? If you don't know, if it's hard for her to say, offer some suggestions, but try to get as specific as possible so that partner can be as helpful as possible. Now, I'm going to go into a realm that might be kind of like a stage 3 in all of this as far as involving partners. I realize that, this is taking it the extra mile. And at the same time, one of the things that I've learned over and over again from running the partner support group is that partners really want skills. They want to know exactly what to do to support their wife or girlfriend in that moment where they're having heightened anxiety or they're feeling incredibly low or depressed. They want to feel as though they're doing something helpful and effective. One of the things I always advise partners to try not to do so much is to feel inclined to fix it. Right? I think a lot of men in particular, feel they have this kind of fix it mentality. If it's broken, then fix it. If you're not, if you're focusing on the negative things, then just stop focusing on those things. And that's oftentimes not at all what a new or expecting mom needs to hear or wants to hear. She wants to be kind of given permission to have her feelings and heard and listened to be taken seriously and validated, and to not necessarily be given that thing that's going to make it all better. And that's uncomfortable. That's asking a lot for partners to tolerate the discomfort of not fixing the situation. However, scratching the itch a little bit of the fix, I do like to offer and share specific skills that partners can use and employ. And I don't mean to suggest in any way, shape, or form that these skills replace treatment for a woman. A partner should not, become aware of these skills and think that they are now a therapist or they can successfully manage the mental health of their wife or girlfriend who's struggling. But these are some concrete things that they can not only kind of familiarize themselves with and perhaps offer as a skill or tool in a moment of what feels like a crisis, but what I will also always tell partners is like, these skills are the gifts that keep on giving, and you're actually going to find they really help you too. So just wanted to include a few of my favorite skills that I share with partners. So the first one is, it doesn't always look exactly like this worksheet, but I refer to it as the worst case scenario, which is a CBT, cognitive behavioral therapy skill. And I'll say, when the new mother in your life in particular is feeling incredibly anxious, she is going to have this unbelievable capacity to go from 0 to 100 in the category of worst case scenario, right? Like, so let's say the baby had a little bit of diarrhea. Oftentimes, instead of looking at that situation for a new mom and thinking, oh, little bit of diarrhea, maybe they have an upset stomach, perhaps it's nothing. A lot of new moms that are suffering from anxiety in the postpartum period will go all the way to, oh my gosh, this is terrible. I need to take my baby to the emergency room. Something's awful is happening. He's never had diarrhea before. I think that this is an emergency. And so one of the skills that partners can use when a new or expecting mom is in that place is to go through this very simple process of worst case scenario, best case scenario, most likely case scenario. And I know I'm not going exactly as this worksheet specifies, but this is what I encourage partners to do. New or expecting mom has already gone to the worst possible case scenario. She's jumped all the way to the worst possible solution. She's gone to all or nothing thinking. She has catastrophized the situation, right? So she's already been there. We don't have to do, really, she doesn't have to do any work in that category. But then we can ask her, what's the best possible case scenario? And let's use the baby had diarrhea as a suggestion. What's the best possible case scenario if we are to stick to the facts and what we know to be true about the situation? Well, the best case scenario might be that, the baby has a little bit of an upset stomach, but it's never going to happen again, right? Best case scenario. What's the most likely case scenario? Well, baby's stomach is upset. He might have a little bit of a stomach bug. Perhaps something was in my breast milk or something was in the formula that didn't sit right. Perhaps he's not feeling well, but this doesn't mean that he's not going to feel well forever. Maybe we just keep an eye on this for the next couple of hours or days. And if it persists or gets more problematic, then we'll call the doctor, right? And so what a partner has done is helped mom kind of close the loop on catastrophizing. And he's helped land her in a situation that's most likely and sticks to the facts and what we know to be true. And if a wife or girlfriend is amenable to this exercise, it can be a real relief to land in that most likely case scenario. Another nugget that I encourage partners to use to support, their new or expecting mom in their life as it pertains to anxiety is these very simple steps. And if not followed, can either lead to a total blowout, but if followed, can totally diffuse a situation that might have gone completely south. There are, in that chapter 4 of Beyond the Blues that I suggested in the beginning, that chapter does a wonderful job of going through all the things that partners can say and perhaps should stay away from saying. But I boiled some of those down into this slide. And so to just help partners understand, it's so common for new moms to feel anxious regarding having a new baby, keeping it alive, keeping it safe. They feel this enormous sense of responsibility. And what might happen in juggling that enormous responsibility is that new mom might jump to conclusions. She might catastrophize or go to the worst possible case scenario, which we just reviewed in the skill prior. She might look at situations regarding the baby as black and white or all or nothing, right? It's really good for partners to know that going into new parenthood, so that when and if it happens, it's not alarming and they know how to respond to it. So what partners tend to want to say and what can escalate and explode a situation, and this doesn't come from a bad place, it just comes from a place of like, well, isn't this what you say to somebody who's having a panic attack or is feeling really anxious? You're overreacting, everything's fine, you're making too big of a deal out of this, calm down, just do blank and everything will be okay. So what happens when a partner responds this way, who ultimately, again, is trying to be helpful, is that mom hears the opposite. What mom hears when partner is responding this way is, you're wrong. I'm not taking you seriously. I'm not listening to you. I'm not seeing how much distress you're in. I'm trying to offer you something that will be a quick fix, and I'm not making space for or tolerating the fact that you are very anxious and distressed in this moment. So then what ends up happening a lot of the time is when partner does respond this way, new or expecting mom starts to dig her heels in, and she can raise the bar. You never listen to me. You're not taking this seriously. You don't care about the baby. I know what's going on and you don't. This is an emergency. You're not doing all of these things the way that you should be, right? And it just goes up from there. People get defensive. And then unfortunately, what could have been a diffuse situation turns into fireworks. What can be incredibly helpful for partners to keep in their back pocket. And I'm going to use one example that came up a few weeks ago in a support group. A new mom who had spent like 3 hours pumping all day and was lucky to have gotten like 4 ounces of milk, put the milk on the table, hadn't sealed it. The milk spilled. Some of the milk got on the table. She started crying. She became very upset. You know, she was incredibly concerned about the breast milk and how hard she'd worked for it. And partner was like, why are you making such a big deal about this? It's just a few drops of breast milk. It's not that big of a deal. You have a ton of breast milk in the refrigerator or freezer that you've been saving for the past couple of months. So what? Which clearly didn't help the situation. But if we're using the breast milk example, perhaps a different way a partner could respond to that is to first and foremost, tell her what you're seeing. I can see you're in a lot of distress right now because some of the breast milk spilled out of the container onto the counter, right? I see you, I see what's happening. I understand and notice that you're distressed right now. Then partner can ask questions and be curious about the situation. Tell me more about why this is so upsetting for you. I see that you know, you're very upset and you're crying. Tell me what that's like for you. And what are you thinking? What are you feeling right now? And then he or she can validate her. I can understand why this would cause you to feel anxious or upset. I know that you just spent the last 3 hours trying to get this breast milk. I know that it takes a lot of work to pump as much as you do and be able to provide breast milk to the baby. So I can understand why this would feel so upsetting to you, right? We're going to validate it. And then after we've done that, we can offer another possible perspective, right? I know that this is upsetting. It's a good thing that you've done so much hard work in creating such a stash of frozen breast milk in the refrigerator for the baby. It's so great that that's in there, so that we have that to fall back on, right? So what partner has done is totally de-escalated what could have been an explosion, has allowed for his wife or girlfriend to feel listened to, supported, understood, validated, and taken seriously. And that's really what a new and expecting mom is looking for in these situations. Another skill that I love to encourage and teach to partners is a dialectical and behavioral therapy DBT skill called Wise Mind. I do use it a little bit differently than it's intended to be used, which is really to encourage and provide insight to people around the fact that we all operate from different parts of our mind, right? And we all possess different parts of our mind. But to make it simple, there's reasonable mind, which is cool, rational, task focused, and there's emotion mind, which typically runs hot, is mood dependent, emotion focused. When we're in reasonable mind, we're ruled by facts, reason, logic, pragmatics. Values and feelings are not important. When we're in emotion mind, we're totally ruled and overwhelmed by our mood, our feelings, and our urges to do or say things. Facts, reason, and logic are not important, right? So the intent of this wise mind concept is for people to be able to merge the two so that they're overlapping in the Venn diagram, creating the wise mind space, which is seeing the value of both reason and emotion, bringing the left and right brain together and finding the middle path. The way I like to explain this to partners is that, especially for new and expecting moms, they live and their jam a lot of the time is in emotion mind. And for partners, and I will always say not to be gender stereotypical, but to be gender stereotypical, a lot of men in particular tend to reside in reason mind, rational mind. That's their jam. Fix it, A plus B equals C. Things are ruled by facts. If you do this, this will happen, right? And how hard it is as a couple who's looking at the very same thing, which is the baby or the situation pertaining to the baby, are both having literally an opposite reaction and response to looking at and observing the same exact thing. So to provide this context of people, depending on what state and side of their mind they're operating from, might look at a situation differently. It doesn't mean that either side is right or wrong. It means that the lens in which we're observing the situation through is different. The ultimate goal is to bring the two together so that they connect and create a space that involves a little bit of both. And this is how I like to kind of conceptualize it for partners in particular. Yes, your expecting mom is, appears to be acting and reacting out of an emotional state of mind. And there is value in that if it's merged together with your reasonable, rational mind. And I think that this can be really helpful as a concept for partners to understand that it's okay to both be looking at it differently and that there is value in both if they can find a way to coexist. And then another one of my favorite DBT skills is the stop skill. This is another skill that partners can use to support their pregnant wife or girlfriend or postpartum. Stop. So very simple. The idea behind this is when you're feeling like you're in a state of anxiety or panic, or you feel this urge to react from emotion mind in particular, freeze, don't react, pause, slow down, give yourself a minute to register the situation. Take a step back, take a deep breath, give yourself a moment, observe, pause, ask what you're feeling, how much and where, and what prompted it, and proceed mindfully. Act with awareness. What would be the most effective thing to do or say right now? Again, sometimes it's hard for partners to intercept a new or expecting mom that is in a state of anxiety or panic. It's hard for him or her to kind of step in and say, hey, let's do the stop skills. But perhaps this is a worksheet, again, that we have on the kitchen counter, on the fridge. And when that's happening, we can reference the stop skills, right? We have had a conversation before that the next time this happens, we're going to look at the stop skills. We agree that this is helpful. And if and when it happens again, we have them right up here laminated on the fridge. So we can use this as a reference to help give us a little bit of pause and relief. And then another really helpful thing that partners can do with their wife or girlfriend experiencing a PMAD, or become familiar with a lot more skills that may be helpful in helping a new or expecting mom combat some of her symptoms and mitigate them. The Pregnancy and Postpartum Anxiety Workbook. Again, this is not intended to be an instrument that helps cure a woman from her PMAD or replaces the efficacy of actual treatment with a mental health provider, either a therapist or a psychiatrist. These are things that can be done to supplement treatment. But again, they're concrete skills and tools that partners can utilize to feel as though they're supporting and helping to bring some relief to their wife or girlfriend who might be struggling. And then lastly, I wanted to end on the fact that dads and partners can have PMADs too. And in fact, 1 in 10 men or birthing partners experience a PMAD in the perinatal period. Now, what I didn't put in here, but I was just preparing before tonight, and I looked back on some supporting research. One of the primary indicators for a man or birthing partner to experience a PMAD is if his or her wife or girlfriend is experiencing a PMAD. So that's when we see a lot of dads and partners experiencing PMADs. Another indication and kind of timing onset that we see at the Motherhood Center all the time is if newer expecting mom is experiencing a PMAD but is starting to improve and get better, ultimately because of treatment, if she's starting to take on more, get more involved and integrated in caring for the baby, taking care of things that need to get taken care of around the house, feeling a little bit more in control and composed. That is usually the onset for a partner developing PMAD symptoms, because he or she has been operating at such a high speed and at such a juggling pace, keeping all the balls in the air while new or expecting mom is struggling and in distress and not feeling capable or able to do a lot of the things that moms who are feeling better can and do. Dad or partner has been doing all of that and working and a million things all at once. And so when mom starts to get better, dad or partner starts to collapse. And so I always keep my eye out for that when I'm treating partners in the day program. As moms start to get better, I'm always looking to see, is he starting to deflate? Is he now able to decompensate or fall apart because mom is able to pick up some of the balls that he or she was juggling for so long? So how PMADs can manifest in partners, they can look somewhat similar as they do in new expecting moms, and there are some nuances. There can be an increased anger and conflict with others, increased use of alcohol and or drugs, frustration or irritability, isolation from family and friends, impulsiveness or risk-taking. This kind of behavior can include reckless driving, extramarital affairs, feeling discouraged or cynical, an increase in complaints about physical problems like headaches, digestive problems or pain, problems with concentration or motivation, loss of interest in work, hobbies, and or sex, working constantly, feeling fatigued, or feeling sad or crying for no reason. These can all be manifestations of a PMAD in a partner. What can contribute to a PMAD in a partner? As I mentioned, if their wife or girlfriend is experiencing one or recovering from one, personal history of depression or anxiety, family history, worries about being a parent. I can tell you how anxious dads and partners can be about becoming parents or fathers. A lot of that is so hidden, and particularly for men, unfortunately, having feelings and displaying feelings isn't always the most applauded way to go. And so a lot of that can be kept inside, out of fear or judgment. Some of the same reasons why moms don't come forward. Feeling overwhelmed with expectations at work, roles of father, this newfound responsibility of being responsible for finances, if that's the case. It certainly isn't always. But those new financial strains of providing for a family, having financial problems, lack of social and or emotional support, stress in relationship with family or spouse, missing attention and or sex from partner. Intimacy can be there can be such a dearth of it, which is very natural, but partners don't always know that. Stressful birthing experience for partners too. I can't tell you how many men and partners experience PTSD after witnessing their wife or girlfriend go through a traumatic birth. Lack of sleep after the baby is born impact impacts partners too, for sure. And feeling excluded from the bond between mom and baby, feeling left out, feeling incompetent. I hear that word a lot from partners when I start to kind of peel away the layers. There's nothing for me to do. I can't soothe the baby like my wife or girlfriend can. I can't feed the baby because I'm not breastfeeding. I don't feel like I'm doing anything right. I feel less than. I feel kind of like I'm failing at this. And I feel really envious and jealous that they're having all this time together, connecting and bonding, and that I'm not getting anywhere near as much of the same level of attention from my wife or girlfriend as I initially was. Now, I'm going to provide you with a bunch of resources here that can be really helpful to partners. And pretty much all of these resources came from Postpartum Support International, PSI. They are the PMAD clearinghouse for anything and everything PMAD related, not only here in the US, but also internationally. They offer support groups, resources, and referrals for people all over the globe. And they also are really building out their dad partner support component. So they have a lot of tips, resources, and even groups available to dads and partners that are struggling themselves or are looking for a like-minded community of other dads and partners that are trying to care for a newer expecting mom that's struggling with a PMAD. So this first link here, which these are all hyperlinked. So when you get this, you can go ahead and click and go to these places. There's some tips about how dads can take care of themselves and their partners. There's some video testimonials from dads who've experienced postpartum anxiety and depression themselves, what it was like, what they did. David Levine is a board member of Postpartum Support International. He's also a pediatrician in New Jersey who had severe postpartum anxiety and depression. So he has a whole blog about how he beat it. There's a boot camp for new dads, and it provides father-to-father community-based workshops and conversations that inspire and affect and equip men and partners from all over the socioeconomic spectrum to be more confident, engaging with their infants, supporting their mates, and navigating the transformation into dads and partners. And then there's the Center for Men's Excellence, also available via PSI, which is a whole bunch of video and psychoeducation for dads in particular around the transition to fatherhood. PSI also offers a first Monday of every month, a chat for dads. Again, this covers the spectrum. If I'm a dad and I'm suffering from a PMAD, or a forum for dads, partners to talk about how they can support their wife or girlfriend who's experiencing a PMAD. Am I the only one who's struggling? You know, this goes on. I think it's a phone call. I'm not sure if it's a Zoom. But the numbers here, there's a participant code, it's free. And again, these are all hyperlinks that you can share with partners if they're looking for a supportive community themselves. So what I've got for this evening to share with you all, just wanted to pause and see if anybody has any questions regarding anything that I covered this evening, or if there's anything that you wanted to mention or add. We have the chat function and we have the Q&A function. If you want to use either of those as a place to pose your questions, would be happy to take any at this point. All right. Well, if there are no questions, I will leave you all to get back to your evenings. Please know that Shannon will be sending this PowerPoint to all of you, so you'll have it at your disposal with all these links and resources I went through tonight. Also happy to answer any questions via email or phone. You see all my contact information that's listed here if anything should come up. So again, just want to thank everybody. Please keep us close as a potential resource and referral for any newer expecting moms that you might come across that are looking for treatment. from postpartum depression and or anxiety. Thank you, and I hope you all have a wonderful night.